regulated by the General Pharmaceutical Council and the Northern Ireland equivalent standards for professional practice. The Green Book provides guidance for health professionals on immunisations, and it covers principles and procedures. The Human Medicines Regulations of 2012 detail the functions of the Commission on Human Medicines, and this is a committee in the Medicines and Healthcare Products Regulations Agency, the MHRA, which advises ministers on matters relating to regulations, safety, quality and efficacy of vaccines. Patient group directions are the framework or the protocol by which vaccinations can be provided in pharmacy when they're not prescribed. In terms of which vaccines can be prescribed and or administered by pharmacists in the United Kingdom, pharmacists can provide vaccinations to eligible cohorts as part of a National Health Service for influenza and COVID-19. In England, shingles vaccinations are also part of a nationally contracted service agreement. Other vaccines such as measles, mumps and rubella, MMR, and pneumonia may be offered on a locally commissioned basis. Travel vaccines and others are provided on a private basis to patients in many pharmacies. An increasing number of pharmacist prescribers will make the scope of this much wider in the future. And the United Kingdom is made up of 4 nations, and arrangements may differ from one to the other. For example, in Scotland, local health boards set the agenda rather than taking a national approach. In terms of describing how vaccination policy for pharmacies came into effect, flu vaccines began to be offered on a private basis in pharmacies around 2012. And this then led to the introduction of a nationally commissioned flu vaccine service in England in 2015. This introduction was in addition to existing services being offered in general practice rather than a substitution. And this led to being able to support a much higher uptake of the vaccine because pharmacies were able to offer walk-in appointments, extended hours opening into the evenings and weekend access. So much so that over 5 million flu vaccines were delivered in community pharmacy in England in 2022-23 as part of the seasonal campaign. So awareness of the campaign has grown fairly rapidly, and many people now access their flu vaccination as part of the NHS service in community pharmacy. Again, healthcare is a devolved matter, and in Scotland, health boards have arrangements with pharmacies in their region. In terms of how pharmacy-based vaccination services are funded in the United Kingdom, in general terms, the NHS vaccination fee is paid through allocated NHS vaccination budgets, and it's not part of the core global pharmacy contract funding amount. Currently, for the 2024-2025 season, the service fee for flu is £9.58. and the cost of the vaccine is reimbursed by the National Health Service as well. In terms of the main challenges that pharmacy has faced, overcoming objections is definitely one of them, mainly from other healthcare providers who had existing services in place when the pharmacy service was introduced. But pharmacy has proven that it can really increase the uptake of those vaccinations, and the target is 75% of the population, so there is always more work to do in that area. There is a role to educate governments about population health and to attract investment in funding. It is definitely a prevention agenda, so investment in anticipation of preventing illness is definitely required, and also considerations around the workforce, so making sure that staffing levels are appropriate to cope with the additional footfall that providing a vaccination service may introduce, and having the appropriate skill mix of pharmacists and team within the pharmacy to enable that to happen safely and smoothly. Vaccination hesitancy is also a consideration, but pharmacists have a really positive role to play in overcoming this. The Pharmacists Defence Association, the PDA, started a campaign during the COVID vaccinations when they were introduced, and pharmacists, PDA members, were able to support this by recording messages in a range of different languages to encourage communities and their families to take the vaccination. In terms of opportunities and the utilisation of community pharmacy networks to deliver vaccination programmes means that those targets of uptake can be achieved, just broadening access because of the location and also the hours that pharmacies operate to complement existing services that may happen in other parts of the healthcare system. Pharmacists are trusted healthcare professionals and live as well as work in their communities, so have a really significant role to play in overcoming vaccination hesitancy within their populations of where they work. And there are also opportunities to add in other health checks, such as lifestyle advice, interventions, potentially blood pressure checks and heart health check services, for example. And currently the Pharmacists Defence Association, the PDA, is undertaking research as part of a programme with a pharmacy in Dudley and Aston University to see if we can help to increase access to other services through the vaccination. So people will arrive to have their seasonal vaccination, flu and or COVID, and then will be offered a range of other services which will be part of a research programme.